More and more women are delaying pregnancy until their 30s, and many are waiting until 35 and even beyond that. So what are the risks of getting pregnant later in life? Well, Dr. Roz is here with the answers. Welcome back.
Great. Good to be here.
So this is a great topic for anyone that is thinking of getting pregnant after the age of 35. What's the magic number with 35? Why do we always hear that?
Well, we certainly do hear it a lot, and the reason being is that, according to American College of Obstetrics and Gynecology, when a woman reaches 35 and she's having a baby beyond that, she's considered advanced maternal age.
Okay, gotta love to hear that, right?
I know, not fun.
Can we call it something nicer?
we really should come up with something different,
yeah.
But with advanced maternal age, you're considered a high-risk pregnant woman.
Okay.
And
so there are some risks, but what you're kind of saying is that, and we'll get to some of your tips here and things that you want to talk about, the risk is really more so on the mother and not as much on the baby, which I think some people think it may be more on the baby.
So it's the condition of mom that predicts the baby's outcome. And so you want to make sure that you're your best, you know, when you're conceiving. So that's what the whole thing is about. You know, it's like the condition of mom, that she's at her best.
Yes. So mom's at her best. Are most babies healthy that are born after?
Absolutely are. Women are getting pregnant very easily in their late 30s, early 40s, and taking home healthy babies. So they're definitely doing that. And so if you're decided to delay when you get pregnant, it's okay.
Sure.
But you want to just make sure you do, you know, a few things like preconception counseling and making sure you're healthy.
Yeah, that makes sense. So does it take longer to get pregnant, or, you know, can we expect the same thing as if we got pregnant in our 20s?
Well, it does take longer. It's the quality of the egg. And so females, we're born with all the eggs we'll ever have, but they're immature. You have about 2 to 3 million eggs that you're born with, but they're immature eggs. But as you age, just like anything else, the quality of it decreases. So it takes a little longer.
Not like wine, though.
Not like wine, no.
I can prove it.
Now, you touched on this a minute ago. Preconception counseling is recommended.
Yeah, and just during that visit, you're working on, you know, do you have diabetes? Like, how are we addressing your diet? Is weight an issue? You know, the diet that you're consuming, starting prenatal vitamins early. So all of those things are important.
Okay. Now, and some risks that are possible for the mother and baby, gestational diabetes and hypertension, those are possible.
They are definitely possibles, and as a woman ages, just like with anything, you know, with our health, how it changes, you're more likely to have gestational diabetes. You're older, you might have problems with diabetes as you age, or even a previous pregnancy where you had gestational diabetes. Hypertension is the other one that you may be at increased risk for. And with those come possibly early delivery, and that mom who's greater than 35 when she delivers.
Sure. And speaking of delivering, you may have a greater chance of early delivery, is that right?
That is absolutely true. And what could possibly cause that is just having fibroids.
Sure.
You know, as women age, fibroids are very, very common, but they can get in the way. You could be at increased risk for something called a placenta previa, and in that case, you may end up with a cesarean section versus a vaginal delivery. So there's lots
to consider. And before we go, special prenatal testing is something recommended. We just got about a second, but
and with that, it's just there is testing to see if there's any chromosomal abnormalities that can happen. It's more likely to happen to a woman who's greater than 35 at the time that she delivers.
Excellent tips as always, Dr. Roz. If you're thinking about getting pregnant after age 35, go see Dr. Roz. drrozmd.com is the website and the location there on your screen. Thanks so much.